Hi friends, welcome to classes by Lab Doctor. In the previous classes, we have discussed about serum potassium. लो सीरम पोटेशियम के कॉजेस क्या है, हाई सीरम पोटेशियम के कॉजेस क्या है, उनके सिम्टम्स क्या है, कैसे हम उसको ट्रीट करते हैं, इन सब के बारे में जाना है. आज के क्लास में लेट अस सी अबाउट यूरिन पोटेशियम. So you know that the normal level of potassium in the serum is around 3.5 to 5 milli equivalents per liter. बहुत कम है ये outside the cell. The major concentration of potassium is inside the cell. So in the serum we see a very narrow range of potassium, that is 3.5 to 5 milli equivalents per liter. In the urine, the normal range of potassium is around 25 to 125 milli equivalents per day. So अगर एक random sample को देखते हैं, that would be around 20 milli equivalents per liter for adults, and in a 24-hour collection we would get around 25 to 125 milli equivalents per day for adults. So I have told you that potassium is an intracellular electrolyte. It is around 150 to 160 millimole per liter inside the cell, and outside it is around 3 to 5 millimoles per liter. So the total body potassium would be around 50 millimoles per kg of body weight, and it is mostly influenced by the age, by the gender, and by the muscle mass also. So whatever potassium is there, it comes from the diet which are rich in potassium, like banana, etc. So that is rapidly absorbed in the intestine, and after body needs of potassium are taken care of, the rest is excreted through the kidney. So the kidney plays an important role in maintaining the potassium level. 90% of the filtered potassium is absorbed in the proximal tube, and this potassium is actively reabsorbed in the thick ascending loop of Henle. So when the dietary potassium is increased, then the potassium excreted by the distal tubule is also increased. When the plasma potassium is decreased, the potassium secretion decreases from the distal tubule. So this is very important, and this is how the kidney plays a role in maintaining the potassium level. So this potassium is very important because it maintains the sodium potassium pump. The resting membrane potential is maintained by this sodium potassium pump. Resting membrane potential is very important for the conductivity of the nerves, for the muscle conductivity, for the heart impulses, etc. So this pump, what it does, it takes in 2 potassium inside and pushes out 3 sodium outside. So comparatively, the inside is more negative compared to outside, and because of this negativity, the membrane potential is maintained. So there are few factors which help in the potassium entry, or it will push the potassium inside the cell, and there are few factors which will push the potassium outside the cell. This is important for us to know the causes of hypokalemia, hyperkalemia, increased excretion of potassium in the urine, decreased excretion of potassium in the urine. For example, insulin pushes the potassium inside the cell. Insulin also pushes the glucose inside the cell. It pushes potassium, it pushes the phosphates, it pushes the amino acid and glucose and fatty acid inside the cell. Aldosterone also pushes the potassium inside the cell. So aldosterone, it helps in the reabsorption of sodium, and it helps in the excretion of potassium. Beta agonist, that pushes the potassium into the cell. So whenever there is hyperkalemia, they give beta agonist. Alkalosis, whenever there is alkalosis, it pushes the potassium inside the cell. So what are the factors which pushes the potassium out of the cell? One is insulin deficiency, like diabetes, aldosterone deficiency like Addison's disease, beta adrenergic blockers, acidosis, and cell lysis. When the cell gets lysed, the potassium inside the cells will come out of it, like rhabdomyolysis, hemolysis, tumor lysis syndrome, etc. So these are the factors which control the potassium. So, what are the causes of increased potassium level in the urine? So, one case could be because of diuretic therapy. Whenever there is increased diuresis, that will cause increased excretion, that will push out the potassium inside the urine. When the patient is given a certain antibiotic like penicillin, carbenzylin, etc., they can push out increased potassium in the urine. When the patient is having alkalosis is loss of potassium. So potassium is lost from the body. In chronic renal failure, where the kidney cannot reabsorb the potassium and the potassium gets excreted in the urine. In starvation, what happens? The body doesn't get enough potassium, and to maintain that level, the cells are lysed and the potassium comes out, and the urine level of potassium can also increase. So the body releases the potassium from the cells into the urine as a result of prolonged potassium depletion, and this can cause increased potassium in the urine. Hyperaldosteronism, I have already told you what it will do. When there is increased aldosterone, increased absorption of sodium and increased excretion of potassium. So potassium will be more in the urine. In renal tubular acidosis, in Cushing syndrome, again hyperaldosteronism will be there, and excessive intake of licorice. Licorice is similar to aldosterone, has properties similar to aldosterone, so that is why it will help in the excretion of potassium. So I've told you, in alkalosis, wherein there is potassium loss, the more of potassium is excreted in the urine. So in alkalosis, what happens? There is low potassium level in the blood also. There is hypokalemia. So this hypokalemia, why it happens in respiratory alkalosis? Because the kidneys are trying to compensate by reducing the bicarbonate production, reabsorption, and this will lead to intracellular shift of potassium. So in alkalosis, there is potassium loss. And in Conn syndrome is a triad of hypertension, because there is increased absorption of sodium, so there is high sodium level, because of which there is hypertension, and hypokalemia because increased excretion of potassium. Now, what are the causes of decreased urinary potassium in the urine? So decreased urinary potassium can happen whenever in case of certain drugs, when we give IV glucose infusion, or when there is a dehydration, when there is a malnutrition. When there is malnutrition, there is no adequate intake of potassium itself, so the potassium level may be low. Diarrhea, in diarrhea what happens? There may not be absorption itself, so whatever is there, it may not be absorbed into the system, and that might cause less potassium in the urine. Whenever there is vomiting, when there is malabsorption, Addison's disease, when there is aldosterone deficiencies, when there is deficiency of aldosterone, what happens? There is decreased excretion of potassium. And acute renal failure, where urinary potassium will be low, that time also patient can have a decreased urine potassium. So acidosis, I've told you what happens in acidosis. In acidosis, what happens? You will see that there is increased H plus ion in the extracellular space. So this H plus ion will shift into the inside the cell, and when this H plus ion shifts in, one positive ion has to come out, and that is the potassium which comes out. So there is increased potassium in the blood. So there is hyperkalemia. So few of the cases of renal tubular acidosis, there can be decreased potassium in the urine. Addison's disease. In Addison's disease, what happens? There is deficiencies of aldosterone, which leads to increased potassium reabsorption by the kidney, and this can cause hyperkalemia, and decreased sodium, increased serum potassium, dehydration, profound fatigue, etc., which can happen in Addison's disease. So these are few of the causes which can cause increased or decreased potassium levels in the urine. Thank you so much for watching the video. Please like, share and subscribe the channel. Thank you.